Today is Sunday, February 17th, 2019, and this is my 5th journal of the spring semester. First question is to describe my role as an athletic trainer during rehab or rehabilitation. So, in the terms of my case that I'm working with, my role with my athlete is to eventually make her get to a point where she is strong enough, comfortable enough, without pain, and doing the correct movement so she can return back to her sport. So we do that with addressing pain, swelling, the 5 signs of inflammation, or the 5 signs of swelling, and then after that we go through trying to get her range of motion back without pain and without compensation, making sure all of her muscles are firing correctly, making sure her VMO is activated for her patella movement, and as well as making sure that her muscles are strong enough as we gradually increase things to return to play safely and ideally. So the next question is, how do you progress your patient? You progress through the phases of healing, as well as you progress when goals are met or exercises become really easy. They can do the exercises with a good amount of weight. Their strength is back up. They're doing exercises without pain. They're not fatiguing them anymore. That's when you progress. Also, you progress certain things at certain times in the healing phases just because we want to protect the new healing tissue. The next question is, how do I know when your patient needs to progress in exercises? So, starting out, exercises should be pretty short, intensity should be pretty low, and then difficulty should be pretty low, because we don't want to put too much stress on the new tissues or the new cells or break the clot or anything like that during the healing phases. So you need to look at the progression of the tissues that you're trying to heal and see, what things are good at that moment in time, as well as so you can, when you start off, the exercises are pretty low in intensity and pretty short in duration, and as time progresses and as they get stronger and more fit with those exercises, they have more endurance, muscular endurance, you can make the exercises longer, as well as change exercises to a different difficulty, as well as either add more weight or add another movement or another plane of motion to those exercises. The next question is, or the last question is, what about progressing goals? We use goals a lot when talking about rehab, just in class and outside of class. Goals of what we want to accomplish in a certain healing phase, or goals of, what we want to not have at the end of this week, or things that we want to accomplish in the day with these exercises, as well as adding in some personal goals. I've seen a lot of people do daily goals, so I guess with my particular rehabilitation case, right now one of her personal goals is to do range of motion without pain. So that's something that we work on daily, as well as something we're working on like during the week, because that is a big factor into the rest of her time in her rehab plan, because you don't want to force anything with pain, because pain could lead to a secondary injury or anything like that, as well as muscle guarding. So you can also progress goals in a way that, so we want to do range of motion without pain, for example. Well, if we do that this week and then next week, well, we want to do range of motion smoothly or without compensating, or we want to add in a hip movement or an ankle movement with a range of motion and make it more specific to a certain motion or a certain plane. But my role with her is to build that relationship with her and make sure that she trusts me and trusts this plan, as well as we're collaborating on her goals and what she thinks that what I suggest that where she should be at, or what we should be accomplishing, and what she wants to accomplish. So in this stage right now with her, she's still feeling a lot of pain with steps and walking and getting up out of bed and into bed, as well as getting knee flexion without pain. So those are some of our goals right now. And when her rehab seems to be going tough, we can discuss these goals or talk about visualizing these goals, since we just learned about visual imagery last week or this week. I think that I'm going to be kind of hinting at that just to see if that could mentally get her somewhere so we can accomplish more goals quicker, just because she is a little bit behind strength-wise and range of motion-wise, just because her surgery was almost 2 months ago, and her range of motion is still very painful, as well as stairs are painful, as well as she still has some swelling. So we're kind of doing that right now in the phase of where she is, as I guess what her daily therapy looks like. Right now we're doing range of motion and quad sets and some BMO activation. So as those things progress, I will either increase sets and reps or add weight on the end of those movements, and then we can get into eventually get into the weight room and do some strengthening things. But my role in the end is to get her back to a safe and adequate place to go back to participating in track and field. So that is my goal, but we're doing it at a safe rate, following the healing phases and her goals and her limits, as well as her strength needs and things like that. I'm not going to try to push her to do something with a bunch of weight if I know that she can't even complete it, because then there would just lead frustration and a little bit of doubt in her, and that might just make her morale go down. So there's a lot of things that go into working with a patient for rehab, but it all just goes together to get the athlete back to return to play in the end. So that is the main big goal, But yeah, so that's my 5th journal.